Here come the Big Rig Kids, y'all. Are you ready? Let's go. Here come the Big Rig Kids. Roll with the Big Rig Kids. Let's have fire the truck take you to such a
Welcome to the Big Rig Kids, guys. I know you were anxious to see us this week because we have a very wonderful and exciting guest who was here before and has come back to grace us so eloquently with her presence. But before we get into that, let's bring in the woman and grandma that everybody knows and loves, and she is about to come out with a new book soon, touching bases on things that are happening in society today. But give it up for Grandma Polly, ladies and gentlemen. Yes. Renee?
Hello and happy Thursday. You didn't bring me in the room, I don't think, because I'm still at the bottom.
You're on.
Okay, hello and happy Thursday. Glad to be here. And I want to thank you guys for joining this evening. We're going to have a conversation this evening about COVID and this variant that's
Hello?
out because it has affected a lot of people. And people are getting so much mixed
You
information
doing well in
about the
yourself?
on. You know, we want to try talking to Towanna and just have her explaining some of the things that she
Who's
knows
calling?
about TV. And Polly is going to be on the phone in a little bit because she's going to tell her
Oh, okay.
story.
Okay. Can I get you to call back in about 5 minutes? Okay. Thank you so much.
And we just want to thank you guys again for joining and joining. And before it's over with, we're going to put up a number where you're going to be able to call in and ask some questions because we want to redirect some of this false information that's out there. And Tawana is here with us today, and I'm going to turn it over to her so she can reintroduce herself. And then we're going to have Polly Ann to call in, and she's going to tell a little bit about her story. Tawana?
do have those misgivings to come in, because I think one of the biggest things, like just being on Facebook and hearing people talk, has been that they'll say, well, you get the vaccination, but you can still get COVID. That's absolutely true. That has not been something that, the developers of the vaccine or the healthcare community just hasn't acknowledged. We've acknowledged that the whole time. From the beginning, the point of the vaccine has been not to necessarily prevent spread, but to prevent severe disease and death. And it has, this is not what I was told, not what I read, but actually what I've seen. It has done that, almost 100% done that. And so today, I just hope we can kind of get the word out. If people have questions, call in. You don't have to agree with me. You can disagree with me, and that's okay. My aim, and I can only speak for myself as a healthcare provider, is not to bully anybody into getting the vaccine because I said so. I tell my patients, if they ask me what I suggest, I tell them I suggest you get it. But if you can't make yourself 100% comfortable with taking the vaccine, I'm not going to push you that direction. I just want you to consider what I'm saying. And if you trust me as your provider, come back and let me vaccinate you. Because there's definitely reasons why everybody should be considering the vaccination.
Tawana, I agree with you 100% because I was someone who sat on the fence at first. And when I thought about it, at first it was in my mindset, they don't know enough about it. I'm not sure this is something I want to put in my body. I'm not a medicine person. I'm more of a person who deals with stuff in natural ways, more of the natural treatments. But I also had to sit down and really think to myself, if this is an experimental drug that they're going to be using on us, what would my possibilities be if I did not take the shots and ended up with COVID and ended up in the hospital after I've seen so many friends and family die and so many friends and family got sick from this? Okay, if I ended up in the hospital, they still didn't have a direct treatment for this. So then I would be in the hospital sick and being experimented on. So in my mindset, which one I felt that would have been less of a trauma to me. And that's the reason I took the shot. But like we said, there are so many people out there for whatever reasons they don't. And I wish it's not to push, it's not to bully, but it's to educate them because people are dying, people are getting sick, and people are dying in mass numbers. And that's just the pro and the cons for me. Either way, it was an experiment. So, what would you say to that when somebody says that they think they're being experimented on?
She talked.
Yeah.
You
So
there,
what
Tawana?
I can admit to for myself personally,
Uh,
you take off. I'm not a healthcare provider, so we were the first, and I'm talking about the first, the forefront of the people who were given this vaccine. So about a month, maybe 2 weeks before
okay. Yeah,
I
this
was
is why.
actually vaccinated for the first time, got the first dose, is when they told us we were going to be the first ones to get it. And you know what I told them? I'm not taking that thing. That's exactly what I said. Because in my head, I felt the same way. Like, I need to have a choice about this. This is something new. I don't know what it's going to do. I see what they're saying. I get the science. I get the
What's your name
research. I get all of
again?
that. But yeah, why should I volunteer myself to be experimented upon? In that time, though, what began to happen was we started to see the numbers creeping up and it started to hit home. And we were coming to work and we were worried every day about who's going to come in with a cough that's not just a cough. Who's going to come in with pink eye that's just not just pink eye. Then I had to think about my daughter at home. I had to think about my parents. And at that point, there wasn't anything else foreseeable to do. We were taking all the vitamin C's and the zinc and all of that stuff, but we didn't know what this thing was more than we didn't know what the vaccine was. And so, yes, I'm going to acknowledge and I'm going to even say it's legitimate that people should feel that this is a new thing that they're trying to experiment on us with. And there was a lot of rumors about how they were going to push the vaccine, and the first people that were going to get it were the kids on HBCU campuses. So added to the mistrust that was there already was wherever these stories were coming from about using young black kids on college campuses as guinea pigs. And so you cannot, there's no way for me to have dismissed that because I didn't know either. Who knows where that stuff is coming from? Is this true? With so much coming out. And so I would agree with people who say I feel like maybe they're experimenting on us, but the reassurance comes from the fact that actually the vaccine science is not new, and so by the time it was time for us to take the vaccine, I wasn't completely comfortable with taking it, but I knew the benefit of having or the risk of taking that vaccine was way less than the risk I would take if somehow I was infected with COVID while in the course of doing my job, came home and brought it to my daughter, or God forbid, went and visited my parents and somehow passed it on to them without knowing. So it was the only thing I could see to do at the time. And I wasn't
Right.
100% comfortable with it, but as time went on and I started to see how things were, the people who were getting COVID compared to the people who got the vaccine, I would rather risk them experimenting on me with the vaccine than getting COVID, going into the hospital, and then having to have them experiment on trying to save my life. Because, like you said, at the time, they didn't have any definitive treatment for it, and you get pumped full of these drugs, steroids, and all of these stuff that comes with their own problems. And even
Right.
after you get rid of the COVID, we have our long haulers who have, I mean,
Right.
permanent heart damage. I know personally somebody who has lost vision in one eye. It just debilitates them. We have a 17-year old who the mom was at her wit's end. He had COVID back in February, hadn't recovered yet. He can't walk. He's always short of breath. He has vision problems. Now he has heart problems, kidney problems. And what do you do with that? Because we don't, there's no
Right.
precedence for treating post acute COVID syndrome. And it involves so many body systems. Nobody really knows what to do to bring people back to health from that. And you imagine at 17 years old dealing with that? You can't go to school. You really can't do anything for yourself. You're in a wheelchair to get around, and nobody's got an answer for you how to fix it or if you'll ever get better. So I think just thinking about what it is to have to personally deal with COVID, for your family members to have to deal with the fallout from you having COVID, and compare it to the risk of having a vaccine that is a little bit experimental, but still is based on really old science and technology. I'd take the vaccine.
Right.
Right.
And that's the conclusion that I came to. And while we're sitting here, you said that we have Polly on the phone, right, Kenny?
Yes, we do. We do.
Polly is a friend of mine that I met when I moved here
Hey, hi.
back in January. And Polly's coming on to tell her story. And Kenny, she could go ahead because they need to hear this. People need to hear this.
Okay. Polly. Polly.
Hi. Good evening, everyone. Can
Hi,
you hear me?
Polly, and welcome.
Can you hear me?
Yes. Yes.
Yes.
Hold on a moment, please. Can you guys hear me now?
Yeah.
Yeah, we can hear
Hello?
you.
We can hear you.
Okay. Well, at this time, I'm recuperating from pneumonia and the COVID. And it's kind of tough. It's kind of tough. I can just say that. Uh, I'm not fully recovered yet. I'm on oxygen in my lungs, and I'm just afraid to go outside and be around anything. And my business, I'm losing my business because before I was diagnosed, which was August 3rd, I had a whole lot of symptoms, but I was avoiding it because I was trying to continue to work. And on August the 3rd, my whole body shut down, and I had to go to the emergency room. Went to the emergency room. They told me they had, I had COVID. They told me you just gonna lose it, sort of going home. We're gonna send you home. They sent me home. I still was sleeping, couldn't get up and do anything. So one night I was so cold, I turned the heater on, and then I don't know what happened. I guess I walked to the bathroom, but I was on my bathroom floor. I don't know how long it was. I was going in and out until I crawled to my other room and I plugged up my phone and I told my friend what was going on. They said, call the ambulance. Call the ambulance. That's it. When I called the ambulance, oxygen level was very low. So they had to feed, put the oxygen on me for me to breathe, everything. And I was in hospital for a whole week. And like I said, this has taken a toll on me mentally, physically, and emotionally. And I'm praying that I get back where I was at. But I got a long road. I still have the sore throat, and I'm still coughing. So that's where I'm at right now with this COVID.
Wow.
Polly, can Polly hear me?
Yeah.
Yes.
Polly, I
What?
know that you
Uh-huh.
were a person. I knew that you were a person who was against the vaccine. And if it is anything that you could say to anyone today about what you have gone through and now taking that vaccine, what is it that you would say to them?
Polly?
Is she still
Uh,
there?
I'm Grandma Polly. I didn't understand what you
Is
said,
she,
and Grandma Polly.
Oh,
What did you say?
she was saying, if there's anything that you could say to anybody out there who might be against taking a vaccine, what would you say to them today?
No, you please take the vaccine, please, because I was one of these people. I will walk past the counter and we're giving free vaccination. I'm like, man, I'm not taking that. I'm not taking that. I'm like, but every day I go in the stores and I see them, people standing in line and get it. And if I feel that if I had got the vaccination, I wouldn't be right, be in my situation. That's for me. Some people don't want to take the vaccination. It's people in my house that don't want to take the COVID test. So I urge people to make a conscious decision about not just your life, everybody's life around you. It's not just about you anymore. I don't know how I got it. None of my workers got it. So how did I get it and nobody else? So I encourage people to go take the vaccine, um, because you never know when you wake up how you gonna be feeling. Because this is not no joke, no more. This is not no joke.
wow, Polly, I thank
Okay.
you for sharing that story with us. But Tawana, now that she brought up another question for me. She has been diagnosed with COVID. She's been in the hospital with COVID, and she's back home now. But there's people living with her who refuses to take the vaccination and go and get tested for COVID. I mean, how can we talk about that? Because it has to be, in my mind, in a situation like that, then it's just being passed from one person to the other. And if I'm wrong, correct me. Because you want to
She
hear me?
said she cutting out.
So
There she goes.
she made
I'm here.
actually she touched on a few points there. That one there, people unwilling to get vaccinated, people unwilling to test. And so a lot of the conversations I have with my patients who, or people in general who just say, I'm not getting vaccinated, there's still some level of common sense that we have to use, even if you are somebody that does not want the vaccine. Part of the problem we see with people who, some people who have decided not to get vaccinated is that they've also made decisions not to take precautions otherwise. They don't want to wear a mask. They're not social distancing. We still having these
Hmm.
huge gatherings of all these people who sometimes are largely unvaccinated. And so my best suggestion for those people that live in the house with her would be that they get tested and or get vaccinated, right? Um, in the absence of a decision to get vaccinated, however, they need to take those precautions. So, all of us have elderly family members, and one of my concerns, is like before my grandmother died back in August, was that she had a lot of young people in and out of the house with her. And
Mm-hmm.
so it worries me
Hmm.
when people are saying, "Oh, I'm gonna be okay. I'm not gonna take the vaccine." And when they say that, the only thing I'm thinking is how unthinking they are about people close to them who have not made that decision. So if you live in the house with mommy and daddy or big mama or whoever, and you coming and going as you please, whether you end up, because you don't know. So the one thing about this virus is it's pretty unpredictable. We really don't know who's going to catch it and have really severe symptoms and who's going to catch it and be asymptomatic, or how it's going to be spread or not. What we know about that Delta variant, though, is that it is twice as just
Okay,
and the
we're
strength,
losing you.
severity of the virus, people get much more sick from it. And so
Hello?
the only advice, the only counsel I could give for her and the people who live with her is that they need to be vaccinated. And in the absence of them wanting to be vaccinated, I mean, they just have to use a level of common sense and wear the mask and social distance and limit exposure otherwise, because they're just like petri dishes coming in and out of the house. And I it's difficult for me to try to
Exactly.
explain how I mean how just we do not know who this virus is going to get a hold of and who it's going to make sick and for how long and to what level. That's the thing that it's almost like some people believe they are bulletproof. And I'm kind of at a loss for words hearing what she went through, and then hearing that she still has family members who are not considering the vaccine. That's difficult for me because I don't know what else it would take other than almost losing a loved one or losing a loved one to change folks' minds about this thing.
And I understand exactly what you're saying, Tawana. Because like I said, I've lost friends and I've lost family members. And in my reality, I just believe that there's not a person in this world who has not been touched or affected by this thing. And not only that, we're talking about living with family members who refuse testing and shots. But then now you're going out in public. And like you mentioned the asymptomatic. I try to limit my trips to the grocery store and stuff like that because my immune system is low. But even when I go early in the morning, I see people walking around without masks, people walking around like we're living back 2 years ago when there was nothing going on. And we're living in a pandemic today. We're in the middle of a pandemic that it appears to me that it increasingly getting worse. But for some reason, it's just not settling into people's mind that this is where we are. And I was having this conversation with someone, and it's like, I think some people are still stuck in a situation, just like with other things, where they don't see change, they don't want change, and they don't adapt to change. So they sit right in that same mold that they're used to, and it's killing everybody around them. And that's difficult for me.
Yeah.
We
And
watch the rallies where they don't want to wear masks. We watch the rallies where they're against the vaccination. We watch the rallies where you're telling me you don't want your child to wear a mask because it's interfering with their breathing. From what I understand with COVID, that's what they're fighting for, their breaths. So
yeah.
you would rather them have COVID than to apply with the CDC recommendations right now. I just think my personal opinion of it is just so selfish that we put other people's lives at risk because we buy into the false narrative that's out there. But there is so much out there we don't know what's true and what's false. But we have to get some kind of a grip of reality on this thing because it's here and it looked like it's here to stay for a while. And I don't want to get preachy, but it bothers me because people are dying every day. People
Hmm.
are getting sick every day,
Yeah.
and we
I
don't know how to fix it. Go ahead,
I was
Tamika.
talking to my sister the other day. You know, she's got two kids. Her little girls, they not old enough to be vaccinated. Um, and she, my sister, she is a healthcare provider. Her husband works in the ER, and so just in our profession, there's an innate risk to that. So every day we come home, we got to worry about what we picked up and what we bring in here, right? And then it's
Mm-hmm.
almost, and I'm being dramatic when I say this, but it's almost like we risking our lives every day to go take care of a lot of people who don't have the same regard for us as human beings, right? And so when you coming in and out of, I think right now we get these daily COVID updates from our CEO at through email at Prisma. And so today I had time to go through and really read through it and see where we were. There's 436 people hospitalized with COVID just in our hospital system right now. And of the 436, 416 of them are unvaccinated. And so you got to think, and I think 400 and I think 16 and then 20 or so are fully vaccinated. Because again, I just want to put this back out there. The definitive goal of the vaccine is not to necessarily prevent transmission, but to prevent severe disease and death. And it has done that. The numbers tell the story completely. And so when y'all hear people say, well, if I get vaccinated, I can still get COVID. Yeah, you can still get COVID. I may have COVID sitting here right now. Maybe. I might. But the vaccine is working. And so when you see that you got 60 people on vents in the ICU and on vents, and 57 of them are unvaccinated, and three of them are fully vaccinated, they say men lie, women lie, but the numbers don't lie. The vaccine does work. And I think people are listening to the things that they want to hear to confirm the bias they already have against the vaccine. So the true things don't necessarily penetrate. The schools are shutting down. You know, we before we got started, we were talking about Pickens County in the first week of school shut the entire school district down because of COVID cases. I don't want to put my hometown on blast, but Carvers Bay and Georgetown High, the entire football teams I heard are quarantined right now. Right?
Yes. Yeah, I
We
heard
got
it.
an elementary school here that shut down for 2 weeks because they went boom with the COVID cases. And it's this really has just started. My daughter, I got a call from the school early this week. From the school, she'd had an exposure. They were telling me she was going to need to quarantine for 14 days, but because I kind of am versed in the CDC guidelines, I explained to them, she's fully vaccinated. When she got home, I had a conversation with her, and I said, "Well, how many kids got pulled for being possibly exposed?" And she was like, "I think it was about 12 of us in all." And she said, and then the principal asked us if any of us were fully vaccinated, and she said, I raised my hand, and I said, "Well, out of the 12 kids, how many other people other than you raised their hand?" She said, "Oh, it was just me and one other little girl." So out of the 12 kids that got pulled for exposure, it was just the two of them that avoided having to be quarantined at home because they were fully vaccinated. Now, I don't really find a rhyme or a reason to that, because my question has been, when there is a positive test in a school full of children who ride buses and play at recess and eat in the cafeteria, who decides where to start and where to end when we decide what kids, how many kids are going to get pulled from the school that have possibly been exposed? There is no science to that. That's like a hit or miss thing. So you might pull these 10 kids, but there's 10 kids over here that you didn't know were exposed to the kid, the kid that the index case that tested positive. And so I don't know. I think the schools are doing as best they could, but it kind of blows my mind how wholly unprepared the schools kind of have been. And that's what it looks like to me. I don't know if I don't know the inner workings, but just the way this thing has evolved in just the last couple of weeks that school has started, it worries me. And I don't know what the answer is.
And Tawana, I can respect that. And you're talking about the schools there in the Carolinas, but a lot of that is going on here in Georgia too. I've watched the news. There was this where not this actual week, but the kids hadn't been back in school that long, and it was where they shut down a whole fifth grade level in a school here. There are other kids that's being sent home. I saw one where I think it was like 120 some kids that they put in quarantine. I don't know how large the school is. My kids are past that school age, but it's happening all over the country. And my question is, you got parents on one side fighting, and then you got parents on the other side fighting. In actuality, the children are the ones who's caught up in the middle of all these decisions that's being made, and they're the ones who's getting sick. In my personal opinion, I believe the children need to go back to virtual learning. I think they opened the country up too soon. And with this Delta variant, from what I understand, is worse than the COVID itself. And if it mutates again, then we're just constantly dealing. We somehow, some way, we got to get a handle on this thing, and nobody has an idea how.
Yeah.
So
That
go ahead.
and that's the thing about the Delta variant. Last year, the largest body of thinking was that, yeah, kids didn't necessarily get infected, and when they did,
Mhm.
they really only had mild symptoms, except in a few rare cases, right? Well, that's not
Right,
true anymore. That's not true. I read an article about, I believe, a 12-year-old girl that's now been in the hospital almost a month, sick with COVID. I
right.
think we have I don't want to fudge the number. It was either 7 or 15 kids currently admitted in our network right now with COVID.
Mm-hmm.
Um, you just it's just like anything else. It's just so unpredictable what it's gonna do and who it's gonna do it to. And so again, I'm being super dramatic, but I think deeply about these things because I just seen the toll. Like when somebody in a household, especially a child, tests positive for COVID, it can turn the entire household on its head. Because if you are a parent and you have 3 kids, like Caden's dad lives 7 miles from us, but I am her primary custodial caregiver, right? I
Mm-hmm.
work full time. I'm blessed because she is a little bit older than, and she could get vaccinated. And, there's times when she needs to be a latchkey kid and we can work that out. We're in a position where, that's okay. But can you imagine if you were a single parent, mom or dad, that works full times and school is your child's, that's childcare for you while you work and make a living to keep a roof over their heads, clothes on their back, and food in their mouth. And somebody calls you and says, Mr. So and so or Mrs. So and so, your child tested positive for COVID or had an exposure to COVID. That child and your other 2 children have to quarantine for 2 weeks. And you don't have childcare and you don't have leave time to take off of work for 2 weeks. Because if you don't work, you don't get paid.
Right.
That turns a home upside down. And
Right.
I
And
don't think people see, and not just that, but think about it like this. You could take the vaccine, maybe you get exposed to COVID, maybe you have symptoms, maybe you don't. Maybe you have to go to the ER, maybe you get admitted overnight, maybe you get a little steroids and some oxygen and you get sent home. Maybe. And you sick for a few days. You don't get vaccinated, you get really sick, you don't have health insurance, you go to the ER, they admit you, and you in the hospital for 30 days. They have to vent you, they have to do all this, whatever they have, they put tubes in your chest, whatever they need to do, they do it. And you end up with, let's say, an astronomical medical bill. So the burden to you is great, but if that happens 20 times on a shift in the ER, can you imagine the burden that it's put on the hospital? You know what else was a part of that email we got today? They have gone to bed in the hallway protocol at the hospital next door to the office where I work. And that means that the beds are so full that now the people who run the hospital have actually given permission and came up with protocol so that when the beds are full, they can put beds in the hallway and the patients will just stay in the hallway for the duration of their stay. They turning away patients that need treatment for other things because they don't have room in the hospital for them. If you have a heart attack and you go to the hospital and there's no place to put you, they're like, sorry, you had a heart attack. Maybe the hospital 1 county over can help you. And those are the things that are happening, like that maybe we don't think about when we're like, nah, I'm not taking that vaccine. Nah, I'm not gonna wear a mask. Nah, I'm not no like the human cost of that is more than just you not vaccinated and you might get COVID. But I for some reason like I don't want to call anybody short sighted. I don't want to call anybody selfish. But we not in Wakanda dying on a hill. Like, how far you gotta go to prove that you free? And it's kind of a slap in the face a little bit to some things and our ancestors and all that stuff. When I hear people kind of talk about nobody's gonna make me do anything I don't want to do, that's fine. I just, that's not the hill I want to die on.
mm, you went real, 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 real deep right there. You really did. You went extremely deep on that. We're gonna stop for a second. We want to thank you guys in the audience for watching. We want to thank you for being here because Tawanna is putting out some real good information. And Kenny, we're gonna turn it over to you for a second. Talk to you people.
To me, all right. Well, um, I'm how do I feel? I've actually got the shot myself, but I was against it in the beginning too. But drove me to do it. I wanted to see my kids and my grandkids more than anything, you know. And my son had a baby boy that I hadn't seen all year. Last year, he had him during the year of COVID, and I just see the pictures and the videos and things like that. And I finally actually got to go see him this weekend, but I waited until I was had the vaccination before I went around him or anything like that. But I understand people's feelings about things because nobody knows anything really, as I see it. As far as COVID, we do have some information on it, but as far as who it attacks and who it doesn't and is asymptomatic, there's no way to really define that. And I haven't personally met anybody who had the vaccine who encountered COVID to speak to them about it, but I've encountered people who have had COVID and their testimonies about it wasn't very good at all. I remember somebody I was talking to the phone. I didn't even recognize their voice anymore. And actually, one of my schoolmates that I went with, it happened last year that he passed. They said it was from COVID, but that's hearsay, and for the reason why he passed for me. But talking to people who had actually had COVID on the phone and hearing their voice, it's monstrous. I guess, for lack of a better word, you don't even recognize their voice, and that was one of the reasons why I was against it. Heck yeah, I was against it, man. I'm like, what? Where this thing just pop out of nowhere, and they're just telling you to take this vaccine. It seems like it is like it seems crazy, you know, just out of the blue. And I have my other beliefs about it. I the whole theory about it coming from Wuhan. I believe that this thing was created. It's biological war. I believe it was created in a lab, basically, and I believe there's the antidote out there for it. And who knows how and why it got out there the way it did. There are a lot of things that float around about that, but I'm not here to delve into that. I'm just here to tell you why I did it, and I believe in trusting God more than I do what's going on. So I stay prayed up on that, because who knows? Who just knows is the bottom line. I understand people's feelings on both sides, and I don't fault anybody for how they feel about anything, because I've been on both sides, and for me, I just wanted to see and be around my grandchildren more without giving anything to them. So there you have it, and I'll give the screen back to you, ladies.
Yeah, I mean, and everything that you said, I agree with you, because you and I have had several conversations on this, and it's just so big. But at the point, the bottom line for me is I want to live. I've seen this thing affected so many people. And when you talked about the voice change, I was listening to Polly on the phone, and Polly actually still does not sound like the lady that I met, but listening to her voice, Polly sounds somewhat better than when she was in the hospital. I remember talking to her on the phone, and she probably don't even remember, because at that time, she calls me Miss Renee. And at that time, all she was saying was miss, 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 miss. Her breath was so short, she couldn't get nothing else out. And that scared the heck out of me. When my girlfriend died, she died by herself. Her daughter and no one else could be there by her side. And for me, that is, it traumatized me in a sense. I gotta be honest, that one, I've dealt with many deaths in my family. Kathy and I have been friends for 30 some years, but her death, and she went so fast. I feel like there is some trauma there for me because, ooh, it's something I never experienced before. And I have to turn the news off because there was one here this week, a lady, she was at home. Towanna, going back to what you were saying, imagine having children you have to take care of. She was at home in her basement recovering from COVID. Her husband is in the hospital still dealing with COVID. She was in her basement and she had a nanny there with her children while she recovered in the basement. And guys, her house caught on fire and she gone. Her husband's still in the hospital, not even knowing that she's gone. So it's very emotional for me to see these people die, and so many of them are dying. And I'm not here to push the vaccine on anybody, but y'all please, for the sake of yourself, if not for anybody else, because the grief is a different kind of grief right now. Before you could get done grieving one person, here goes another person gone. You don't have time to stop and grieve. And it's painful. It is very, very painful to sit down and know that somebody died and you could not even be there by their sides. Just to even tell them a goodbye. Yeah, it's been almost a year and it's still real painful for me. It's like it was just yesterday. Don't know what it's going to take or whatever it's going to take. Just for yourself. Just do it, please. Because I've known too many people who have crossed over. And I'm going to stop right there because I'm getting emotional. Towanna, y'all could go ahead.
Yeah, like I know people that have lost, 6 family members in the span of 3 months from COVID, and I got patients that come in all the time. I mean, just sitting there in the exam room with me and just bawling their eyes out, that not have not necessarily lost family members, but have had to go through having COVID with them. And this is not, you lucky if you get infected with COVID. I shouldn't say lucky, but just for to illustrate my point, you lucky if you get COVID and you have it for a week, 2 weeks, and then you better. But we see so many people that come in that are in the hospital for 30 days, for 45 days, for 90 days, that, might be admitted for 2 days and then get sent home because, oh, you'll be fine. We'll send you home on oxygen. And a week later, they back in there with pneumonia. And then they got to, like I said, get pumped full of all these other medications to try to fix what's wrong. And they got tubes in their chest to drain the fluid out of their lungs. And they got blood clots. And they got just all this stuff. Kidneys want to shut down. And so it's not COVID itself, it's the experience of COVID for yourself and for the people around you who love you. Like, I have a coworker whose mother, I'm sorry, this lady is 102 years old. She was in a nursing home. She counted on her kids being able to come see her every day. My coworker came to work every day for a year, crying because she could not go to see her mother because of the precautions they had to take. Like, COVID or no COVID, this has taken a toll on families. I was so used to seeing my parents every other weekend out of the month. I would drive to Georgetown, stay for 24 hours, 12, whatever, just to peep in on them. And when this thing broke, the first 3 months, it was torture for me that I couldn't go home to see my parents because I didn't want to risk taking anything to them.
Yeah.
It hasn't just been the virus itself, it's been the experience of the virus for
Yes.
everybody. And I
Yes.
think everybody should be
Mentally.
able to identify with that. And like I said at the top of this, I'm not going to bully anybody or my patients come in, and it's just like anything else with them. I still want to empower them to make the decisions for their health care themselves. I'm going to offer my best suggestions based on the clinical experience that I have, and then they can take it from there. So I'm not going to bully anybody into taking a vaccine. I don't want to point fingers and say, "Oh, this is the reason." That there's so many factors at play here about, like, like Kenneth said, we this is not necessarily what we're here for. But if we talk about the politics of this thing, some other things come into play, and then we
Right.
get kind of out in the weeds. But there's so many other things that come into play when we have patients coming in who don't trust the vaccine, who don't want to take it, and end up suffering the toll of what it means to have COVID, to have a family member with COVID, to have somebody they know die with COVID. And what I don't want, and what I do have conversations with them about, is what are you willing to risk?
Right.
Are you willing to risk maybe having a few little side effects from this vaccine? Maybe having even, because possibly if you could have a few more serious complications of vaccinations. Okay, I get that. But what are you willing to risk? What price are you willing to pay when you make the choice between deciding to get the vaccine and not getting it? And whatever you were comfortable with, that's what I want you to do. And like y'all said, I understand both sides. I've just seen so much of one side that
Right.
I'm starting to lean over here quite a little bit.
I understand because it messes with the mental after a while. You get so much of both sides of it, and
Hmm.
it is what it is. But I want to thank those people who stopped in to watch today, and I'm hoping you got some information from this. And we're not here to push it, and we're not here to push it in one way or the other. We're just here to have this conversation, and hopefully you walk away where it puts you in a position to where you may think about it more, or go and do your research. That's the best thing. Do your research and figure out what works for you and how to make it better for yourself. And I'm gonna close it. That's my final thought right there. And I'm just gonna say, y'all follow the Big Rig Kid page, follow us on social media. And for real this time. I'm being quiet. I'm giving it back to Kenny and Tawana.
Well, I just want to thank Miss Polly for calling in. I was hoping that she can get back into the conversation because her story was so heart wrenching. But thank you, Miss Polly, for taking time out of your schedule to join us today. I know there's a lot to talk about in it. Tawana, always, you're amazing. I love the
Yes.
hair. You know it. And my sister Renee, thank you so much for bringing this to the forefront and to the attention of people. I You put me on spot tonight, but that's all right. I'm gonna talk to you about that.
I
But
know you did that. I was telling you to go to the people in the audience, but it was cool.
yeah. I also, I got to definitely thank them. Miss Chantel, Lawanda, Bishop Kilpatrick, Michelle Great, a bunch of wonderful people joined in tonight. Latanya Myers, Artavia, I'm just looking at some of the names right now. Yeah.
Absolutely.
Can't even get them all. But Lou Esther Sims and Lena Pryor, thank you all for taking time out of your schedule today to join us. I know it wasn't the
Usual
smile,
upbeat, upbeat.
but Grandma Polly wanted to really discuss this today, so that's where we went with it. So we love you, thank you, and Towanna, if you have any final comments, we definitely would love to hear them. Is she there? Okay.
Actually, way off subject. Renee and I talked the other night. I do want to send sympathies and condolences to the Green
Yes,
family, the Franklin family, um, the Grimmage family for the loss of their loved ones earlier this week.
Oh,
yes.
Um,
Thank you, Tawana, for
when
bringing that
when
back to my attention. Yes,
when Renee does the show, the show about her book, there's so much in that book that it reminded me of when I got that. Listen, it chokes me up because there's so much I feel like we've lost as far as the village. Renee
yes,
and I talked about that. So I just wanted to take a minute and just send love and prayers back to our home community. Because it's tough. On top of everything else, I cannot imagine what they're going through. So love and prayers to all the families um,
yes,
of the souls that were lost the other night.
yes, yes. Thank you for bringing that back to my attention, Tawana. This and here you go. You just brought back to what I said a few minutes ago. I was here after I saw on the news this morning where the lady was recovering from COVID and she was in the basement and she died, but the nanny was able to get the kids out.
Mm.
That happened last night. What you're talking about, the travesty that happened in right down the street from where I grew up at, okay? Walking distance. That happened night before last. So before you could get a grip on one thing that happened, here you are, you're wrapping your brain around something else. And to my people back home, believe us, like Tawana said, we are grieving with you guys. And we send our condolences, we send our love, and we send our prayers. Because before you could grieve through one thing, something else happens. And y'all, we just need to keep praying and get back to our village. That's another conversation we're going to have. But we got to get back to that village. And that's it. Love you guys.
well, thank you all for joining.
Woo.
Just want to remind you that every Thursday night at 7 p.m., you can check out Grandma Polly here live on Facebook, talking about things to better society. Ladies, if there is nothing else, I want to just blow everybody a kiss. Thank you for tuning in, and we are out.
The big rig kids, roll with the big rig kids. Let's Sapphire the truck take you to such amazing places with the big rig kids. Those helpful big rig kids. See how they give and grow and get to know amazing things. Learn with the big rig kids, and you'll see how it is to have adventure days and hang and play with all your friends. Because the big rig kids know what it is to live a most exciting and inviting life is positive. Sapphire with the voice of wisdom keeps the story rolling, and by golly, Grandma Polly drives them all to where they're going. Hop on in, everybody. Let's go! Caden, he's the leader of the crew. He's smart and brave and true. Sasha, Caden's twin, she cares a lot but can be stubborn too. Caden loves a good book too. And then Sasha, she's a regular computer guru. These are the big rig kids. Roll with the big rig kids. Let Sapphire the truck take you to such amazing places with the big rig kids. Those helpful big rig kids. See how they give and grow and get to know amazing things. Now Maria can be rude and bossy, braces on her legs and knees, but it's not fun and hard to run with a disability.